Side health care, we now turn from how to keep yourself safe in the new year to what every woman of childbearing age should know, and we are now joined by a house call from our Dr. Ryan Dick, a family medicine physician at the Healthy's Venice Heights Clinic. Thank you for joining us.
Thank you so much for having me. I really appreciate it.
And a new dad yourself, too.
Yes, very much so. Yep, now she's 3.5 months, so that's
awesome.
Very exciting.
So what is some of the advice that you would like that you think every woman of childbearing age should know and do even before they think about getting pregnant, perhaps?
Yeah, excellent question. So I really feel like if women who are relatively young right now do some things, make simple health changes right now, they really can use that down the road when they do decide that maybe pregnancy is on the horizon. And so a lot of the changes that they could do at this moment in time, it'll have a lot of implications down the road. I mean, some really simple things that women can do, what I've recommended to a lot of the women that I see at the clinic, is first of all, start taking a multivitamin. There's a couple of minerals that certainly you can get through fortified foods and different supplements as well, but I really find that folic acid is a really important mineral. Vitamin D and calcium are just 3 common things that, again, you can get through dairy products and some fortified breads and things like that, but it's very unusual to get enough, especially in young women specifically, because, again, there are those pregnancy implications down the road. Okay.
Fortunately, it is in a lot of foods today, on our breads and cereals and that, but how much folic acid and some of those other vitamin D, I mean, how much should you be getting every day then? Really,
most doctors are recommending right now 400 micrograms. So on a bottle, that's going to look like 400 mcgs, not to be mistaken with milligrams. And it's pretty easily found on a label. More commonly found probably on prenatal vitamins than just, the ordinary multivitamin tablet. But it's a pretty easy thing to look up, and sometimes I'll even have my female patients bring in their bottle if they have any questions in that regard. I'm glad you brought up the fact that it is certainly in some fortified foods and whatnot, but the reality is it's simply not in enough foods as it is, and it's very difficult to get too much folic acid. So that's why I usually end up recommending a once-a-day multivitamin, just to help with that.
What about the vitamin D?
The vitamin D, most women should be taking at least 800, and here's another puzzler sometimes, international units. So 800 international units is what most doctors are recommending, and they should be taking that on a daily basis. We're finding that young women really should be taking that kind of supplement because down the road when we look at bones and osteoporosis and things like that, it's really the minerals that you're taking at a younger age which are helpful down the road. We find that we're sometimes catching women a little bit too late, and it's really better to be taking that, anywhere between the age of 16 and 30.
And it seems like the obvious question that you would want to do this so you're in good health, but why should you be doing this? And why, if you're in your early 20s and you think, well, I'm not going to get pregnant for years, I mean, why should you be doing this?
Well, specifically just addressing the folic acid, for example. When we're looking at young women, we find, in the more recent research that we're doing, is that women really benefit themselves better by being on a folic acid supplement for even a year or 2 before pregnancy itself. I mean, I think most women at this point in time know that they need to be on some sort of vitamin during their pregnancy, but now we found that even a year in advance, you can even do that much better as far as taking care of yourself and your baby when it comes to some of the things that we worry about during pregnancy. Folic acid specifically affects how the brain of the baby develops, how the spine develops. It can prevent heart defects and can really prevent preterm labor. And a lot of that is based on all of that folic acid that they took well before the pregnancy rather than just during the pregnancy itself.
Well, I hadn't heard that before about the preterm labor and stuff like that.
Yeah.
What are some other things that women should be doing?
So other things that would be very helpful, I mean, you always hear about doctors talking about diet and exercise. So when I talk to my patients in the clinic, whether they're female or male for that matter, we talk about what are basic, simple things that you can do. Doctors oftentimes recommend 5 to 7 days out of the week, and I think that's a really good goal to have, but sometimes that can be really overwhelming for people. And so what I've found that just simply increasing your exercise 1 or 2 days out of the week can be really, really helpful. And not only can that help with weight loss, but it can prevent high blood pressure, diabetes, And those things are also things we worry about in pregnancy too. When it comes to diet, again, keep it simple, so that if that means instead of eating out and maybe eating a few more calories than we're supposed to be doing anyway, maybe supplementing that or taking a salad, should I say, instead of that. And then not only eating something healthier, but maybe eating something with fewer calories. And again, it's just one basic, simple thing that you can do on a daily basis that can have really a long-term effect down the road.
And when you're talking about exercise, back to that, you're not saying you have to join a gym or anything like that.
No, I mean, I think a lot of times when people think about exercise, they think that they have to join a big gym, they have to join a major weight loss program. It can be as easy as running, taking the dog for a walk, doing something between 30 and 45 minutes just to get their heart rate up, build a little bit of a sweat up, and it can be really, truly as easy as that.
What about gestation diabetes? That you're seeing more women perhaps developing that, or?
I think that's probably becoming more of an issue now. We're seeing obviously a few more women who are having problems with being overweight, being obese. When we talk about specifically diet and exercise in pregnant women, we really focus on making good lifestyle changes and really to hopefully avoid that problem of having gestational diabetes, diabetes that you develop during pregnancy. When we look at those simple diet and exercise changes we're talking about, we don't work on weight loss. That's certainly not something we're doing, but maybe weight gain will be a little bit less in those women who have problems with being overweight or obese, rather than that 25 to 35 pounds that we would expect most women to gain during pregnancy. For those women, it'd be somewhere between 15 and 25 pounds instead.
It's not the time to actually be dieting, though.
No, you don't want to be, trying to minimize calories or things like that. We really emphasize more so on focusing on healthier foods, looking at your vegetables, looking at maybe not consuming as many sugars as you were usually eating, before the pregnancy itself. But we're certainly not working on weight loss or taking away food. I mean, because that baby needs nutrition, obviously.
What about women always say, well, I had this craving for, I don't know, chocolate milkshakes or something like that.
You know what? There's nothing wrong with having a chocolate milkshake from time to time. I mean, just because you want a healthy diet doesn't mean you need to subtract out all those bad foods that you're craving. That might mean you need to eat less of those things. I mean, so there's nothing wrong with one chocolate milkshake from time to time. But when it comes to cravings, sometimes by eating maybe watermelon or something else sweet that you know is going to be a little bit better for you instead of eating the chocolate or eating something with a lot of sugar in it, maybe that's the way to go. Or obviously the vegetables are good things too. So if you're having a craving, really turning or having something available to you ahead of time, such as some carrot sticks or a vegetable or a fruit, it might be an easy way to prevent yourself from maybe craving and going for those other chips or something like that.